Hello. In this video, I will tell you about diabetes mellitus and its complication in older patients. Sugar can cause many physical changes in our body. There are many ways to diagnose blood sugar, but here we will discuss just physical examination of diabetes, because physical examination is the only way to examine the exact severity of disease. That's why medical experts decided to divide sugar's physical examination into 11 parts. We can self-examine our sugar through hands, through skin, through blood pressure, through axilla, through neck, through head, through eyes, through abdomen, through insulin injection site, through legs and through feet. First of all, in this video, you will know how diabetics can diagnose diabetes with their hands. In this video, you will know about hand diseases caused by sugar. There are 5 basic hand diseases caused by diabetes. The first is Cheiroarthropathy, the second is Dupuytren's disease, the third is carpal tunnel syndrome, the fourth is Flexor tenosynovitus, and the fifth is muscle wasting. Diabetes is a deadly disease. If it is not treated properly, its effects can begin to show on the hands, which is called Cheiroarthropathy. In Cheiroarthropathy, the movement of the joints of the hands is limited, that is, the joints of the hands feel stiff while moving. Like other diseases of the hands, Cheiroarthropathy also begins to manifest itself at a certain age in patients affected by diabetes. Its specialty is that when stiffness is felt in the joints of the hands during movement, then pain is not felt during that time. Palm and finger joints, the joints between the fingers are more affected by it, and sometimes it also affects the ankle and shoulder joints. Stiffness between the joints starts from the little finger and spreads to the thumb. Cheiroarthropathy is found in 30% of diabetic patients. The main cause of the disease is the lack of physical examination of the patients. Now we will know about the treatment of Cheiroarthropathy and how this disease can be treated. Cheiroarthropathy can be confirmed and standardized in 6 different ways, such as pain relievers, anti-inflammatory drugs, physiotherapy, joint stretching, muscle stretching, regular sugar check.
Diabetes is a deadly disease. If it is not treated properly, its effects start to show on the hands like Dupuytren-like symptoms. When Dupuytren occurs, one or more fingers of the hands begin to curve towards the palm, due to which patients find it difficult to straighten their fingers. Know one thing well: before the fingers become crooked, the wrists begin to form. Neglecting the wrists of the hands leads to crookedness of the fingers. When the blisters start to form, there is no pain. But when they are growing, then there is a feeling of constant pain and itching. It mostly affects the ring finger or the middle finger. And when the fingers become crooked in patients due to this, then the palm and finger joints are affected like a sack. Dupuytren is often prominent in diabetic patients, and 30% of patients are those who are over 50 years of age or whose blood sugar level is more than 200 milligrams. If a patient has been exposed to Dupuytren, timely diagnosis is very important, because it can be estimated from its evaluation that how much it has affected the hands. To diagnose it, a specific type of tabletop test is done under the supervision of expert doctors. In this test, the doctor asks the patients to keep their hands straight on a table. If there is no space between the patient's palm and the table in the test, then this test is considered negative. On the contrary, if there is a gap between the hands and the table, then it is considered positive. This gap is checked with a pencil to see how high the gap is. So far we have only known about Dupuytren disease, but now we will see how it is treated and how many types of treatment are possible. Dupuytren can be treated in 5 different ways. Treatments such as radiation therapy, collagen injections, hand surgery, vitamin E and laser treatments are possible. Do your hands feel numb while sleeping, or do you feel weakness in your hands? In this part of the physical examination, we will learn about the complete details of carpal tunnel syndrome. This disease is caused by the inflammation of the median nerve between the bones in the wrist. To understand carpal tunnel syndrome, you must first know about carpal bones and carpal tunnel. The bones in the wrist that help the movement of the wrist are called carpal bones. There is a space between the carpal bones from where the veins and nerves pass, which is called the tunnel, and the space between the carpal bones is called the carpal tunnel. If you have numbness in your hands, the median nerve plays an important role in controlling arm and hand movements through the brain and spinal cord. The median nerve passes through the tunnel through the wrist to enter into the palm, from where it joins the thumb, to the index finger and also to the middle finger. What are the causes of carpal tunnel syndrome? It is caused by blood sugar, thyroid disorder, fluid retention, high blood pressure, joint inflammation, and bone fracture. What are its symptoms? A feeling of weakness in the hands while holding something, a feeling of pain in one or both hands, a tingling sensation in the fingertips, swelling due to pain in the fingers, thumb, forefinger, and middle finger, include burning or tingling sensations, and numbness in the hands while sleeping at night. Now we will see how carpal tunnel syndrome is diagnosed. The recommended procedure for making a diagnosis is to first take your medical history. Medical history includes previous history of your joints and bones, blood sugar level, any injury, etc., and any family member having diabetes or carpal tunnel syndrome. After the medical history, your physical examination is done. First of all, you are asked to check the strength of the hands, then the inflammation in the wrists, shoulders, and neck is checked where the sensation of pain is felt by pressure. If any symptoms appear after the physical examination, a specific test is done for it, which is called a nerve conduct study. In this test, the stimulator is placed over the median nerve and a current is given to the median nerve from the electrode and anode. After giving the current, the active electrode, which shows the near movement, and the referral electrode, which shows the movement away from the active electrode. To treat it, it is important to know your age, your health and medical history, how bad your wrist is, and whether the medicine you will be given is appropriate for your health. How bad is your disease, and what is your opinion about your own disease? For its treatment, an effective method called splinting is done, in which a bandage is wrapped around the wrist so that no movement is possible in the wrist, and due to lack of movement, the pressure on the median nerve also decreases. Another effective method is anti-inflammatory drugs. The most commonly used method of anti-inflammatory drugs is direct injection at the site of carpal tunnel syndrome. The third method is surgery. It is mostly done in people who have a lot of numbness in their hands. The fourth method is exercise, in which neither you will have to take medicine nor expensive surgery, you can do it at home. We show you how to do the exercise, which includes pressing with the hands, bending the wrist down, pressing the ball, moving the hand right and left, bending the wrist down, turning the wrist upside down, moving the hands, bending the fingers, holding the ball and moving the wrist up and down, holding the ball from the wrist and spinning straight on the table.
Do you feel pain when moving your fingers? Generally, trigger finger is the condition in which the fingers hurt due to inflammation in the tendon. Your fingers have pulleys that become tight due to inflammation, and a tendon runs through the middle of the pulley, which cannot move due to the inflammation of the pulley. Due to continuous movement during inflammation in the pulley, inflammation also occurs in the tendon. Due to inflammation in the tendon, the finger joints become sensitive and hence pain is felt during movement. There are bones and tendons in the hands and fingers. Tendons that move and connect muscles and bones together. The muscles in the fingers provide flexibility in the fingers, which help to straighten the fingers and also help to turn the fingers towards the palm, while the tendon moves within the pulleys if the pulleys are inflamed. Pain is felt during which is called trigger finger. When the tendon passes through the pulleys, first A1 pulley comes, then A2 pulley, then A3 pulley, then A4 pulley, and so on, finally A5 pulley. If one of these pulleys gets inflamed due to any defect or injury or suffers from inflammation or due to any other reason, pain is felt in the fingers while moving. It is very important to know about its symptoms. When the fist is closed and opened, a shock is felt in the fingers. Apart from this, there is a feeling of stiffness and pain between the joints of the fingers. When there is stiffness in the fingers, due to stiffness, or during the stiffness, the fingers are straightened, then during this period, the sound like breaking a bone is also prominent. Now we will see in which people this disease can occur. This is mostly in diabetes patients, who are between 40 to 60 years of age, hypothyroidism, arthritis, TB patients, or people who use their hands more in their daily work. If we talk about the diagnosis of this disease, a specific physical examination is done for it, while if we talk about a laboratory test, no specific laboratory test is done for it. Yes, if you are suffering from diabetes, then some tests can be done to help diagnose it. On the contrary, if we talk about radiology, it may be needed in patients who have a lot of swelling of the hands, or whose movement between the joints of the fingers is impossible, or those who have wounds in the joints of the fingers. Now we will talk about its most important part, that is, about its treatment. You can treat it at home. If the nature of your illness is minor, then you just have to leave your daily activities and rest for 4 to 6 weeks. A splint can be used to prevent movement. You can also apply heat to reduce inflammation. Or you can improve its movement by creating flexibility in the fingers. You can also treat it with medicines which are more effective. Pain relievers such as ibuprofen or naproxen can also be used if the pain is severe. Apart from this, the use of anti-inflammatory drugs and due to excessive inflammation, steroid injections can also be injected.
Do you know that weight loss in sugar is also a disease? Let's see what is muscle wasting according to its definition. If IR occurred due to any disease, your muscles become weak, shrink or end completely. Such a condition is called muscle wasting or muscle atrophy. This disease occurs mostly in diabetic patients. Due to this disease, your body may lose strength or you may be unable to move. You know what muscle wasting is, now you know what the causes of muscle wasting can be. The main cause of this disease is immobility, that is, people who cannot feel movement in a specific part of the body or sometimes in the whole body due to an accident or disease. The duration of the effect of this disease is from 10 to 42 days. Apart from this, this disease affects people who are more than 50 years old because as the age of a person continues to increase, the ability of the human body to work also decreases. Such as the low formation of protein that plays an important role in building muscle. In this video you will also know how to protect yourself from it. Apart from this, it also affects those people who consume very little food or use such a diet which has low protein content or do not include fruits and vegetables in their daily diet. It affects diabetic patients the most because the amount of insulin in diabetic patients is low and insulin plays an important role in building and growing muscles. There are many people who know the symptoms of this disease late. It causes numbness in the hands and feet, tingling in the hands, difficulty in holding an object, weakness of one arm or one leg compared to the other leg, memory loss and menstrual irregularities in women, including coming too late. Only if you know about its correct diagnosis then correct treatment is possible. The first physical examination is done to diagnose it, so that it can be estimated what is your nature and what medicines you have used or been treated before. During the physical examination, you should describe your symptoms in detail. After the medical examination, various tests are done to know your mental condition, in which nerve conduction studies are usually done. Apart from this, electromyography is also done, a separate and detailed video of which will be broadcast soon. Apart from this, laboratory tests can also be done according to the nature of the disease in some patients. Creatine kinase is a test that is sometimes done to check muscle weakness because when the fibers in the muscle are broken or the muscle is injured for some reason, then the amount of creatine kinase in the blood increases. Apart from this, urine test is also done. If your body has more weakness, biopsy is done for it, in which a small piece is separated from your muscle and sent to a specific laboratory for examination. Apart from laboratory tests, radiology tests can also be done. In radiology, a chest X-ray is done in which the movement of the lungs is checked or a CT scan is done for all the internal examinations of the body. Apart from this, MRI can be done through which the smallest defects of the body can be diagnosed. Now we will tell about its treatment, which is the most important to control this disease. The most effective method for this is exercise. To get your body back to its former state or healthy body, it is important to make daily exercise a routine. This is especially important for people over the age of 50 because their bodies need more movement. We tell you some specific exercise methods that you can do easily and your health will improve quickly. Lifting weights, standing and bending, sitting and standing, pulling weights, stretching the muscles of the legs, walking with weights, lifting weights from the shoulders and lying straight and lifting weights. If you are exercising, then you should also take care of your diet. Yes, as much as exercise is necessary in muscle wasting, it is necessary to use food correctly. If you eat a balanced diet, your body will also be balanced. Therefore, you should use such a diet that helps you build and increase. In this way you will be safe from muscle wasting. Let us tell you about some balanced foods. Balanced foods are the first foods containing protein, which include milk and milk products, meat, fish and eggs, etc. After that, the most important thing for the muscles is vitamin D, which maintains the strength of the muscles because it absorbs calcium, and it is calcium that makes the muscles hard and lively. If you want a complete detailed video on vitamin D, you can express your opinion by commenting. Then there is omega-3, which reduces excess fat from the body and makes the muscles flexible. It is usually found in seafoods.